Hi, I'm Dr. Jackie. I make videos about child and adolescent psychiatry. If that's interesting to you, like and subscribe and join the team. I've had a lot of comments lately mentioning my demeanor or how I come across, that I have a soft voice, that I'm soothing, which all of that is lovely, and thank you so much for saying that, and I appreciate it so much. At the same time, I don't want you to think that you have to look, sound, act like me to be a good psychiatrist or enter this field. I truly believe by showing up as authentic as possible to yourself, then that allows your patients and your families to be able to show up as authentically and genuine to who they are as well. That would include all the best parts of ourselves and all the parts that are areas of growth for ourselves. I believe truly the biggest barrier is working through your discomfort as a clinician, not necessarily knowing all the answers, and as I've talked in previous videos about not being able to truly connect because you're so focused on what you're going to say and what you're going to do next and how to fix something. Whereas really, in order to truly build that connection, you have to be super present as much as possible. I caught myself and I was about to say like every second of that interaction, which is of course a big ask. But if that's possible, to be able to let go of who, what, why, when, where, and truly listen, make sure that the person sitting across from you is actually feeling 100% heard to the best of your ability while you're getting to know them. I feel like that would be the most positive interaction. There are so many barriers to being able to navigate something like this in modern medicine, especially time, especially the questions you have to ask. Being able to provide a solution that you feel like is feasible for the patient is really difficult. You have to navigate your own anxiety, your concern about whether you've missed something, the next patient already being in the office and you running late, you not being able to get the treatment for your patient families because of their insurance or a lack of supply in the medication. There are so many hurdles that we have to jump over in order to get our patients the things that we think they deserve. A lot of it is financial. That leads to the moral injury that we might experience being unable to be effective because of the system in which we work in. A lot of people focus on that aspect, and it is a both and situation, being able to appreciate that that's something that we have to be able to navigate. We hopefully get better at it with time to anticipate the hurdles that we're going to have to jump so that they can feel a little faster and lower to the ground in terms of our ability to get our patients what they need. I would say that the connection that I build with my patients and families could not ever be replaced by anything else in this world, and being able to watch them grow in their understanding of themselves and what their mental illness looks like for them, and that they're capable of still doing amazing things, that the medicine doesn't take away their personality or the amazing talents and skills that they have, but in fact can actually allow for that to really shine and grow, that it's not a forever thing for a lot of people. And if it is a forever thing, that's something that we can talk about and process together. It's always a safe place, or at least that's really the #1 priority. And having that type of trust in a doctor-patient relationship is just utmost in psychiatry, but I would really say in every medical field. This is just what I found my personal skills to have led me to, and I felt like when I was on every other medical rotation that I just really wanted to connect and talk about people's families and how they were raised and what their experiences with their relationships are, how they were feeling, what emotions were they experiencing, and all the complexities about that, their thoughts that they might not have wanted to have or are guiding their decisions, and it didn't feel like the choices that they would have made if they weren't struggling with those thoughts. Going back to the whole point of this video is I want to make sure that you don't think that a soft voice has to be necessary. There's a lot of performance in what we have to do, so that if we're noticing that we need to meet you with similar energy, or if I need to not match you and actually change the way that I'm acting, or the volume or the speed of the way I'm speaking will actually help in the situation, in our interaction, then that's what I'll do. And being able to use that in a way that fits your personality or who you are is really important. We all ask very similar questions, and finding the way to phrase that in a way that actually makes sense for you and feels right for you as it comes out of your mouth is also something that you'd work on throughout your training and in a career in psychiatry or mental health. What's nice is that I get to really evolve and develop as a person and as a clinician in the same way as my patients and families do. It's very much a mutual parallel process, and it's truly a journey, not to be corny, but it can be really fun to experience that throughout the years, especially when you're doing outpatient care. I think that's all I have to say for right now about that topic. Just be authentic as much as possible to you, and know that that will continue to grow and evolve with time, and things grow where you water it. If there is something that is an area of growth for you, then there's nothing stopping you from really focusing on that and figuring out what is it that I don't like about that. Is it really actually something that needs help or fixing or attention? And if it is, then reading more about that, talking to your therapist about that, asking your friends and family about it, and seeing if it's something that interrupts your interactions or something that would actually, with a little tweak, would be really helpful. Is it time and place that you're using it? I don't want anyone to ever really feel like their personality is being diminished. It's the time and place aspect of a lot of things that really make the difference. With that, thank you so much for watching, and have a great week.